What is an enteral stomach tube? An enteral tube is a medical device that goes straight to the stomach or intestines. Enteral tubes are used for giving nutrition or medicine when they cannot be taken by mouth. They can also help release air or drain fluids from your child's stomach. The nasogastric or NG tube goes in through the nose, down the esophagus, and sits in the stomach. The NG tube is held in place by tape on the cheek, an upper lip, or sometimes a bridle. The nasal bridle ties the tube in place through the nose and must be replaced every month. Changing the NG tube tape. If your child has an NG tube, you can clean your child's face and nose with a warm, wet washcloth as usual. If the tape needs to be replaced and the tube does not have a bridle clip in place, be sure to cut pieces of tape and have them sitting nearby. With one hand, hold the tube firmly against the skin near the nose. Using the other hand, remove the old tape, pulling it off the skin towards the nose. You may clean the skin of the cheek with a warm, wet washcloth and let the skin dry completely. Replace the tape over the tube on the cheek and over the upper lip. If the tube comes out partially or completely, call the clinic and notify them. If after business hours, bring your child to the emergency room as soon as possible and do not give any other feedings or medications. The G-tube goes in through the skin of the abdomen and sits in the stomach. An inflated balloon at the end of the tube keeps it in place inside the stomach. The GJ tube has two channels that go in through the skin of the abdomen. The G portion sits in the stomach and the J portion sits in the jejunum, which is part of the intestine. An inflated balloon at the end of the G portion keeps the tube in place. To clean your child's G or GJ tube, remove the old dressing if present. Using a Q-tip or gauze, cleanse the site with mild soap and warm water. Allow to dry. Apply ointment to the site with Q-tip if ordered by your medical team. Do not apply any lotions or creams to the site unless ordered by the doctor. Apply new dressing if desired. Checking the G-tube balloon. The G-tube has a balloon on the end that sits inside the stomach to keep it in place and prevent accidental removal. It may be required for you to check the balloon at home. With one hand, hold the tube down firmly against the skin. With your other hand, attach an empty 10 milliliter syringe to the balloon port. Pull back to check the amount of water filling the balloon. The nurse or doctor will tell you how much should be in the balloon, depending on the type of tube that is in place. Push fluid back into the balloon, continuing to hold the tube flush to the skin. Add sterile water to the balloon if needed to keep the tube secure. Replacing a G-tube. To replace your child's G-tube, first prepare the new tube by gathering supplies of 10 milliliter syringe, sterile water, and lubricant. Clean the old tube well with mild soap and water before beginning. Using a 10 ml syringe, draw up your sterile water. Before replacing, you want to check that there is not a leak in the balloon. Put the syringe into the balloon port of the tube and flush in 3 to 5 mLs of water. Once confirmed the balloon is intact, pull the water back out of the balloon. Put lubricant on the end of the tube and reinsert the tube into the G-tube tract. Hold the tube firmly against the skin and flush the appropriate amount of water into the balloon port. The nurse or doctor will tell you how much should be in the balloon, depending on the type of tube that is in place. Remove the syringe from the balloon port and you may let go of the new tube.